So what I'm going to be doing with Asha here, our brave participant, is that we're going to be going over a brief posture screen. This is something that I do with all of my patients whenever I first meet them. And the reason that I do it is that your posture tells you a lot about what habits you have as a person in your day-to-day life. It tells me what positions you put yourself in regularly, and how you may kind of strain your body in a repetitive way. And the more information that I can have about that helps me to figure out the reasons for your problem, and then we can try and attack the cause of the problem rather than just treating the symptoms. So whenever I meet somebody for the first time, what I ask them to do is just stand up for me, and we have a look at the way that they stand. So it's always a bit awkward when somebody is looking at you standing, and so I just kind of ask them to shake it out and stand as natural as you can with somebody staring at you. So whenever I start looking at the way somebody stands, I always start at the bottom. I start at their feet, because your feet are your foundation. They can give you, and all of the motion that you have and the habits that you have in your feet translate all the way up your chain. So when I start looking at Asha's feet, one of the things that I notice is that her right foot turns out slightly compared to the left. Now, the other thing that I can see in her right foot is that her arch here, you can see that there's a little bit of rounding to the inside of her foot, whereas it's a little bit flatter and straighter on this side, and that tells me that her arch is a little bit dropped on this side. That's important because if we go up towards her knees, if you look at where this kneecap is pointing compared to this kneecap, this one is pointing quite straight, whereas this one is actually pointing a little bit towards me. So that means that there's a little bit of internal rotation or twist inwards of the hip or the knee joint. So what I'm going to ask Asha to do for me is just try and lift the inside of her foot a little bit. And I don't know if you can notice what happens to her knee. So if we look at her knee here and I let her drop her foot again, if you can see the twisting and the different direction where that the kneecap points in. And all of that movement, just changing the arch of the foot and the positioning of the foot, changes what happens in the hip, up a little bit higher. The other thing that I like to look at as we move higher up the body is some creasing in the shirts. So if we look at Asha's shoulders here, you can notice that we've got some creases happening in this right shoulder. That's a first telltale sign that there's a little bit of rounding and rolling in that right shoulder. So the other thing that I can notice here is that the right shoulders drop downwards a little bit compared to the left side. Asha told me that she is actually left-handed. And normally what we see in the dominant side is that shoulder is actually lower. We use those muscles, they're more relaxed, they're stretched out a bit more in the dominant side. So Asha's dominant side is actually higher and tighter. It tells me something very significant about the tension that she's holding in this musculature here. So I'm going to get Asha to turn and face the wall over there. So when somebody stands and we look at them from this side, there's a couple of things that we want to see. We want to see the front of the ear here lining up with the shoulder and the hip and the ankle at the bottom. We want a nice straight line. And then we want to see an easy transition from the neck to the upper back. The upper back is meant to round forward. The neck is meant to curve inwards. One thing that's noticeable with Asha is that she has a bit of a prominence here as we transition from the upper back into the neck. And I don't know if you can see, but there's a little bit of a crease happening here. That tells me that there's some strain happening in this area of the neck. And this is really, really common with somebody who sits at a desk, rolls their shoulders forward, and sort of carries their head in front of the body. And you can see that Asha's ears are just a little bit ahead of where you want them to be. If I was to correct Asha's posture a little bit, what I would do is I would get her to lift up from her chest, and just lifting up from the chest, you can see that this area here softens quite a bit and it's not quite as prominent, which is why posture is so important for the health of your spine.